एवरीवन एंड वेलकम टू माय चैनल क्रिएटिव स्पेस। आज हम अवेयरनेस स्प्रेड कर रहे हैं अबाउट रेडिएशन ऑन्कोलॉजी। ये एग्जैक्टली क्या होता है, किस टाइप के कैंसर्स इसमें ट्रीट हो सकते हैं, क्या ट्रीटमेंट्स है, क्या मिसकंसेप्शंस है लोगों को इसके बारे में एंड मच मोर। आज हम इसके बारे में सारे पॉइंट्स, बेसिक पॉइंट्स डिस्कस करने वाले हैं एंड वी हैव विद अस अ वेरी एक्सपीरियंस डॉक्टर संजय, जो सह्याद्री ग्रुप ऑफ हॉस्पिटल से भी एसोसिएटेड है। सो लेट्स गेट स्टार्टेड एंड डेफिनेटली शेयर दिस वीडियो. लेट्स हेल्प अदर्स. Thank you, Dr. Sanjay, for doing this for my channel and welcome to Creative Space.
Thank you.
तो डॉक्टर संजय, मेरा पहला क्वेश्चन, बेसिक क्वेश्चन ये होगा कि रेडिएशन ऑन्कोलॉजी एग्जैक्टली क्या है?
See, radiation oncology एक branch है. It's a branch of oncology. Basically, oncology is divided. If you look into surgical, जो surgeons operate करते हैं, medical जो chemotherapy देते हैं, and the last is radiation, where they treat cancers with radiation. Radiation is nothing but an X-ray treatment. You use high energy X-rays to kill the cancerous cells. That's very simple way to understand what is radiation.
ओके ओके ओके. और कैसे काम करता है? मतलब आई थिंक आई विल स्किप दिस बिकॉज यू, आई थिंक इमीडिएटली यू एक्सप्लेन दैट, सो आई विल स्किप दिस क्वेश्चन. ओके. और कैंसर ट्रीट करने के लिए व्हाट आर द ट्रीटमेंट्स? बेसिकली कैंसर को ट्रीट करने के लिए क्या क्या होते हैं, कैसे टाइप ऑफ ट्रीटमेंट्स होते हैं?
See, basically जब कैंसर डायग्नोसिस होता है, इट्स बेसिकली ऑन योर बायोप्सी रिपोर्ट. जब टिश्यू, जब कैंसर जो भी पार्ट में है, उसका थोड़ा टुकड़ा काट के बायोप्सी करके वी रियलाइज कि व्हाट टाइप ऑफ कैंसर इट इज. बेस्ड ऑन व्हाट काइंड ऑफ कैंसर और व्हाट टाइप्स ऑफ सेल्स आर देयर, योर मैनेजमेंट इज बेस्ड ऑन दैट. ओके, सो अगर आप देखोगे तो योर ट्रीटमेंट बेसिकली अगेन 3 डिविजन्स. सर्जिकल, जो ऑपरेट करेंगे कैंसर्स को. उसके बाद कभी कीमोथेरेपी होता है जो मेडिकल ऑन्कोलॉजिस्ट हैंडल करते हैं, या फिर उसके बाद रेडिएशन होता है. नाउ फॉर एग्जांपल आई टेल यू, ब्रेस्ट कार्सिनोमा, जो ब्रेस्ट कैंसर क्वाइट कॉमन इन इंडिया, उसके लिए फर्स्ट एंड द फोरमोस्ट, अगर कहीं स्प्रेड ना हुआ हो तो फर्स्ट थिंग इज यू ऑपरेट द पेशेंट. ऑपरेशन के बाद बेस्ड ऑन द हिस्टोपैथोलॉजी रिपोर्ट, जो कैंसर को हम काट के टेस्टिंग के लिए भेजते हैं, वो रिपोर्ट में जो आता है उसके ऊपर हम डिसाइड करते हैं कि क्या आगे होगा, कीमोथेरेपी होगा या रेडिएशन होगा. और कीमो के बाद रेडिएशन कितने दिन का होना चाहिए, कितना डोज, that all we decide based on the histopathology report which comes after surgery. So all 3 modalities are used sometimes. और ऐसे भी होता है कि suppose you have a voice box cancer, जो larynx cancer बोलते हैं, very early stages, only radiation is enough, no need of chemotherapy and no need of surgery. Okay, and for example again women gynecological cancers, cervical cancers, which are again very common. Early stages में you operate the tumors, थोड़ा लोकली एडवांस्ड हो, थोड़ा स्टेज 3 तक है, तो अगेन सर्जरी करने का कोई मतलब नहीं. यू डू कीमो एंड रेडिएशन, रिजल्ट्स आर ऑलमोस्ट सेम. सो इट डिपेंड्स ऑन व्हाट काइंड ऑफ ट्रीटमेंट टू बी यूज्ड बेस्ड ऑन टाइप्स ऑफ सेल्स इन द ट्यूमर एंड व्हाट स्टेज द ट्यूमर इज.
ऑलराइट. ओके ओके ओके, थैंक यू फॉर एक्सप्लेनिंग दैट. एंड इस फील्ड के बारे में, क्षेत्र के बारे में 2-3 मिसकंसेप्शंस क्या है डॉक्टर?
See, maybe 10-20 years back अगर कैंसर होता तो कैंसर was a, you know, the line for death. I mean, they would say कि this is the end of life. कैंसर जिसको मिलता है कि डेथ सेंटेंस की तरह होता था. But things have changed. Not all cancers can lead you to death, because even now stage 4 cancers का cure rate almost 80-90% हो चुका है. I'll tell you for an example, lung cancer, जो कि already metastatic हो, कहीं और spread हुआ हो. The treatment for lung cancer, which is spread to other organs, now with the immunotherapy and also targeted radiotherapy, जो precision medicine करके हम बोलते हैं, you can have a cure or control rates of almost 80-90% in such cancers. And even the breast cancers, maybe stage 3, stage 4, 5 years, 10 years before, we never used to have any targets. So there we used to just control. अगर कहीं spread होता तो we wouldn't be able to, you know, cure the disease. But now I see patients of breast carcinoma running for almost 10 years. Metastatic है, stage 4 में है, 10 years हुआ है, फिर भी कुछ ना कुछ oral tablets पे अभी चल रहा है. They are still doing well. So that is the paradigm shift we have had from, you know, non-curable to something which we can control the patients for stage 4 cancers.
तो ये बहुत बड़ा मिसकंसेप्शन था पहले कि वो
Yes.
नहीं ट्रीटेबल है, अभी वो है ट्रीटेबल. अभी इसी का फॉलोअप क्वेश्चन मेरा ऐसे होगा कि देयर वाज न्यूज अ फ्यू मंथ्स बैक कि जो देयर इज अ ट्रीटमेंट फाउंड फॉर कैंसर. हाउ ट्रू और फॉल्स इज दैट? मतलब जैसे आपने कहा कि फ्यू कैंसर्स आर ट्रीटेबल, बट ये जो न्यूज आया था यूरोप में कि कैंसर इज क्यूरेबल, तो was it dependent on this, or what was that news about?
See, I think that basically came for colorectal cancers, rectal cancers के लिए. They found a drug where they started giving without operating the patients, and they found some cure in some patients. I mean, that's still a case report. Yeah, I wouldn't say not properly analyzed, study. Usually, जब कैंसर के लिए कोई ड्रग आता है, we test and then we get into the market. We go through different phases of randomization. like phase 1 होता है, phase 2 होता है, phase 3 टेस्ट करने के बाद then we implement it and then we see the results of it. Probably this was phase 1 study जो अभी initial phase में है, study चल रहा है. You cannot write it off saying कि कैंसर के लिए क्योर मिल चुका है, this is the wonder drug. There is no wonder drug in cancer as such.
Okay, thank you for clearing that. And एक इंसान ने कभी रेडिएशन ऑन्कोलॉजिस्ट को अप्रोच करना चाहिए, अंडर व्हाट सर्कमस्टांसेस?
See, again, if you have a cancer, see, even radiation oncologists are also oncologists. They are also cancer specialists. So you can meet a radiation oncologist for any of the cancers you have or for a routine cancer checkup ke liye. And also for screening. Many women now needs to know what the screening is. Screening जो ऐसी चीज है, screening का मतलब होता है you screen healthier patients. Screening is not for someone who is diagnosed with cancer. Screening is for someone like you and me, who are healthy individuals. On day-to-day basis, you need to screen so that you pick up अगर कैंसर सेल्स है या कैंसर का एब्नॉर्मलिटी आप में है तो पिकअप करने के लिए जो टेस्ट करते हैं स्क्रीनिंग टेस्ट बोलते हैं. तो फॉर स्क्रीनिंग यू शुड ऑलवेज मीट ऑन्कोलॉजिस्ट. रेडिएशन ऑन्कोलॉजिस्ट आल्सो फॉल्स इन द सेम कैटेगरी. If you're diagnosed with cancer, again you can consult a radiation oncologist. They can also diagnose you. They can tell you what next should be. Either surgery होगा या chemotherapy करना है या फिर radiation करेंगे. वो call radiation oncologist भी ले सकते हैं. So you can meet any of the, जैसे you meet medical oncologists or surgeons, you can also consult radiation oncologist for your cancer queries.
ओके, जैसे आपने कहा कि वुमेन के लिए भी आजकल बहुत इंपॉर्टेंट होता है टू गेट देमसेल्फ चेक, जैसे कि एमएमआर है या पैप्समेयर है, उसके बारे में थोड़ा सा ब्रीफ बता सकते हैं डॉक्टर प्लीज?
See, again, screening is again important modality. Probably Western states, Western countries में screening is prominently practiced. और उनके cancers, why, if you compare to India, why we are lacking is because the diagnosis जो होता है यहाँ पे, it's quite late. We don't pick up cancers early when compared to Western population who pick up very early, probably in stage 1 में. यहाँ पे we get to know in later stages. The whole the idea is to pick up early by doing screening. So India में screening उतना popular नहीं है. Most of them don't go. They wait for the symptoms to come. They don't do routine screening. As long as you're healthy, you don't visit a doctor, right?
Yes.
So the whole point is that. So जो pap smear which you're talking of is basically for cervical cancers. The recommendations are women above the age of 30 years should start doing pap smear every 3 yearly. एक बार gynecologist में जाके pap smear करना जरूरी होता है. And every 5 year something called HPV co-DNA testing. HPV जो है वायरस है, human papilloma virus, which causes cervical cancer. So every 3 years you do pap smear, every 5 years HPV DNA testing, co-testing करते हैं on the same person. So that picks up any cancerous cells in your uterus or in your cervical region. Similarly, breast में again screening is very popularized. We recommend usually screening from the age of 40 years annually. Every year एक mammogram करना जरूरी होता है above the age of 40 years till 70 years तक. 70 years के बाद there is no recommendation to do it. So every year a healthy woman above 40 years should do a routine screening mammography.
Okay.
क्योंकि that may not pick up cancer, but it can pick up any benign diseases also, like fibroadenoma हो सकता है, fibroadenosis हो सकता है. So these are all risk factors for invasive cancers at some point of time. So you pick up early, you treat them, you're always screening every year, and you pick up these cancers very early अगर आपको होता है.
Okay. Thank you for creating this awareness, doctor. And इस ट्रीटमेंट के लिए किस टाइप के इक्विपमेंट्स यूज होते हैं?
See, if you talk for a radiation oncologist, I'm radiation oncologist per se. The equipments what we use is basically linear accelerators. So linear accelerators are, if you've seen an X-ray machine, थोड़ा बहुत scientific है, थोड़ा बहुत science behind this is X-ray, how X-rays are produced. Exactly the same way linear accelerators में हम लोग X-ray produce करते हैं, and this X-rays are accelerated uniformly. Linear acceleration होता है. They move very fast, so that the energy which comes out of these rays are tremendous when compared to X-ray. X-ray usually we measure in kilovolts, kV बोलते हैं. if you look at the X-ray का जो भी reading हो, 15 kilovolt, 20 kilovolt, 30 kilovolt. But when radiation is given, it's measured in megavolts, MV. So it is 10 additional. kV 100 में होता है, megavolt 1000 में होता है. So that energy is higher, acceleration is higher, so that it penetrates the body tissues, deeper into the body tissues to treat the cancer cells. So linear accelerators are something different that used to treat cancers, which we work on. Radiation oncologist.
Sorry, you continue.
So radiation oncologist works on linear accelerators. That is a machine which we usually treat patients on.
Okay. And is it painful, doctor?
Not at all. I think if the question is asked to me, I would say, is X-ray painful to you? Not at all. So just like how X-ray is not painful to you, radiation is also a pain-free procedure.
Okay. Glad to know that. And anything else I must have missed asking you? In general, जो basic है, जो बहुत common है, जो लोगों को नहीं पता है, would you like to say something on that?
Only thing is I like to highlight about warning signs of cancer, which I think everyone should be aware of as a healthy individual. Screening to anyway, I told you in India screening is very popular only now for breast and cervical cancers, or lung के लिए, prostate के लिए उतना it is not coming to so much of practice. But I think women gynecological cancers के लिए breast and cervix is must. Every woman should get screened for these cancers. And again, there are a few warning signs if you ask for cancers, any healthy individual के लिए. One is hoarseness of voice, जो होता है, sudden change in voice, and which is not resolving with your antibiotics or any medicines you're taking. And any mole or a wart जिसका size बढ़ना चालू होता है. There's a small mole on your shoulder or on your neck, on your face, which keeps increasing. You notice कि ये बढ़ रहा है लेकिन painless है, बढ़ रहा है. That is one of the warning signs of cancer. Any lump in the breast, always evaluate. अगर breast में कुछ lump है, make sure you meet cancer specialist. It could be anything. Okay, or change in your bowel habits या bladder habits में, your frequency या constipation हो या loose motion हो जो resolve नहीं हो रहा है, that is one of the signs. And sudden weight loss, you see suddenly maybe 2 महीने में you lose more than 10% of your actual weight, so that is also a warning sign of cancer. And again, blood in your urine. Suppose you pass urine and you pass blood clots, or you hematuria जिसको बोलते हैं in the terminology, it's a blood in urine. So these are the 6 warning signs of cancer. Any of these warning signs you find in your body, please make sure you go and visit an oncologist to get it evaluated.
Okay. And you spoke about mole. Increase in the moles in human body is quite common. Can that be an alarming factor also? Not the size, but the moles increase. Like, we get.
Unlikely. See, there could be some moles which could be even warts. You really don't know. Some warts or skin tags जो thickening हो सकते हैं. Number of moles doesn't correlate to cancer. It's about the size of those moles which are increasing.
All right. Okay. Thank you for clearing that. I think we are done with our interview and segment, and you have explained that. आपने बहुत easy तरीके से explain किया है. So thank you for that, Dr. Sanjay. Thank you.
Thank you so much for giving me this opportunity. Thanks a lot. Bye bye.
Thank you.